Did you see him?
Certainly. Mayor Brook, Commissioner Sarah. I did hear him just a moment ago. Commissioner Vignola,
Present.
Commissioner Simmons,
Here.
Vice Mayor Carter, present. City Manager Babnick,
Here.
City Attorney Hearn.
Here.
Everyone would please rise and join us in a moment of silence. So I asked for this emergency meeting because of the coronavirus and to make sure that we stay ahead of things and not engage in panic. At this time, I'm going to turn the meeting over to our city manager, Frank Babinick.
Thank you, Mayor. Mayor, we have an agenda. We're going to go through a list of items that staff has prepared to bring the commission and the public up to speed on where we are today and where we're going in the near future, as well as what some of our plans out a little bit further. We also have some folks in the audience that I've asked to join us that I'll bring up, for example, Jarrett from Broward Health Coral Springs will come up and kind of tell us what the hospital is doing and some of our other partners. That way we have a good idea inclusively what we're doing as a city. But before we do that, it is the request of staff that we declare a state of emergency consistent with what the state of Florida has done and Broward County has done.
So John, if you'll explain the legalities that we're about to go through.
Sure, thank you. As everyone knows, the governor entered an executive order stating that COVID-19 poses a risk to the entire state of Florida and declared a state of emergency on March 9th. On March 10th, Broward County declared a state of emergency due to the effects of COVID-19 found in Broward County. So this declaration of state of emergency, we have done it several times over the past few years, almost exclusively involving hurricanes. However, what this does is under Chapter 19 of our Code of Ordinances, and as well as Florida Statutes 252 and 870, it provides authority due to state of emergency for things like emergency procurement being probably the most salient one for this type of emergency. And the mayor, under Chapter 19, has the authority to sign it. And how we've normally done this is we've called in the mayor, had the mayor sign it, and then at the next regular scheduled meeting, it gets approved by the commission. In this case, just because of the timing of it, Mayor, I would ask that you formally declare that state of emergency, sign your document, and then I'll ask the commission to approve it since we happen to be all here.
Okay, very well, thank you. So be it declared as the mayor of Coral Springs, Florida, that due to the foregoing conditions, I hereby declare a local state of emergency exists in the city of Coral Springs effective at 8:07 a.m. on March 13, 2020. Effective immediately, we'll be evaluating, suspending permits, events, activities, or groups on an as-needed basis. Pursuant to Section 19-3 of the city's Code of Ordinances, the city's procurement code is hereby waived. Emergency procurement is hereby authorized to be signed by the city manager. The city manager is hereby designated as the city official authorized to issue emergency orders pursuant to Section 19-3D of the city's Code of Ordinances. This declaration of emergency shall continue in effect from day to day until declared to be terminated. This declaration of emergency and all emergency orders and regulations enacted or rescinded shall be confirmed by the City Commission at the next regularly scheduled meeting, which is now, unless the nature of the emergency renders a meeting of the City Commission impractical, which it hasn't, and I appreciate everybody being here, including Commissioner Sarah, on such short notice. This is dated this 13th day of March, 2020. And I'd like to ask for the Commission to ratify this decision with a motion.
Move to approve.
Moved by Commissioner Vignola, seconded by Vice Mayor Carter. Any discussion on the motion? Commissioner Sarah, you're okay with no discussion at this point? Great. Okay, all in favor, please say aye.
Aye.
Any opposed?
Aye.
Okay, very good. Thank you, Commissioner Sarah. Thank you. It's approved 5-0.
Thank you, Mayor.
My pleasure. So one of the main reasons, too, that I asked for this meeting on such an emergency basis is not out of fear, but to be proactive in our community, as we always are in the city of Coral Springs, and to educate and inform and make sure that we're dealing with facts and not fear. So, Frank, I'm going to turn it back over to you.
Thank you, Mayor. So, Mayor, we have staff that's going to be helping out with this presentation and kind of filling in certain areas. So we have a plan that addresses employees, addresses public, addresses events, and how we're going to do business moving into the future. So we're going to start off with our employees. We've been messaging employees now for several weeks on what the recommendations are, how to keep themselves safe, how to keep their work environment sanitary and clean, and to do our best to keep our employees from getting sick. So I'll turn it over to Alex. He can go over to some of those details, and then Chief Perry, Chief McNally, and Deputy City Manager Kernauer are here to kind of fill in some of that information. We'll have discussion on the employees, and then we'll move to the next subject.
Sounds good. Thank you, Frank. Thank you, Alex.
Thank you. Good morning. So basically what we've been doing is providing our employees with a list of recommendations of what they can do to keep themselves healthy, to keep their workplaces clean, so that we can continue to provide service to our residents. So some of those recommendations that we're rolling out to employees, we're recommending they keep 6 feet of distance between anybody when they're in City Hall, when they're interacting with the public, if at all possible. We are providing PPE to certain employees. What that means is personal protective equipment. If they're coming in contact with members of the public that may have this virus, our first responders, firefighters, police officers, and other city staff, they're going to have PPE to wear so that they're not getting this virus. We're providing guidance on sick leave and flexible work schedules. We understand that some schools may, it's spring break's coming up. We want to make sure that we're providing our employees with that flexibility to take care of their families. And we're also making sure that any employee, if they are having signs and symptoms, they're encouraged to stay home so that we can help quell the spread of this as we move forward. We've entered into an improved and enhanced cleaning schedule of all of our city facilities, this building being one. We've acquired different types of vital oxide sprayers. What that is a hospital-grade disinfectant, so we're disinfecting buildings such as this on a regular basis, especially in our public areas. So you'll see our facilities crew, they've been doing a great job already to work on that. And then we break down our recommendations based on class of employees. So we've already provided to all of our police officers a comprehensive list of recommendations, comprehensive list of procedures and policies that they need to follow. The same has been done for our dispatch as well as for our fire rescue personnel to make sure that they're handling all of these calls appropriately. With that, I'll let Chief Perry and Chief McNally if you have anything to add.
Thank you.
From the police department's point of view, we are following all the protocols that Alex just laid out. We're telling our officers to make sure they take care of themselves. Obviously, common sense rules, washing your hands, disinfecting areas. On top of that, when it comes to handling calls, our dispatch center has been advised to have a list of questions to ask to determine if we are going to come in contact with somebody who may be affected. If that exists, Protocol 36 will be announced over the radio, which will indicate, to our officers, okay, we need to take extra precautions. Personal or PPE equipment has been issued. I know that I'm working with the fire department, Chief McNally, to secure more because of the panic that's going on right now. There is a backlog of that, but we feel confident that more is on the way. We've had it secured. We're expecting shipments of more materials soon. If our officers get there, we're asking them to take common sense. If there's something that we can do either report-wise over the phone or through the internet, we will do that. We have an online reporting program that we've had for years, so that's up and running. And if it doesn't require a face-to-face human contact with somebody, that's probably the best way to go. Should we come in contact with somebody, obviously our personal protection gear will be worn. We will take every precaution. If we have to take somebody in custody, we will do so. With that, after that's done, our officers have a plan to decontaminate themselves and decontaminate whatever vehicle they've used. And, we're working with the sheriff's office to determine what the protocol is going to be for, the jails. We expect to have that out either later today or early next week.
Great. Thank you very much, Chief.
I echo a lot of the comments from Chief Perry. We've been working closely with Alex in Emergency Management, with the Police Department, to make sure that the first responders, and not just first responders, our general staff are prepared, are provided with the appropriate level of equipment to protect them. Training has been conducted. This is something that we've trained on in the past, and the appropriate measures are taken when they go out into the field if they should come into contact with anybody that has flu-like symptoms. We're treating it the same way. We're making sure that the patients are taken care of, we're making sure our responders are taken care of, we're making sure that they are not going to be at risk. And then the second part is we're making sure that that transfer of communication is happening with the hospitals. We're working closely with our medical director, Department of Health, Broward Emergency Management, to make sure that as details change, if anything changes, we enhance and modify our procedures moving forward. We also make sure that the apparatus are deconned afterwards, so that we don't pose any risk to the next patient we pick up. So those measures have been in place. We've been in constant communication with our command staff, with our folks. Training is being done almost on a daily basis, and we feel confident in our measures.
Great. Thank you very much, Chief. Really appreciate it.
Bob, you have anything to add? So, Mayor, just a couple other things with that. We're also advising staff, and I don't know if I missed it or not, but we're advising staff to curtail meetings and use technology for meetings rather than having face-to-face meetings whenever possible. In the fire department and police department, we've suspended all outside riders, no observers, nobody that's part of the organization will be riding on any of the apparatus. And the other thing we're doing is we're working with HR and the department directors to ensure that our own at-risk staff are being looked after as well. So if we have somebody that has a diminished level of health for whatever reason, we don't want to unnecessarily expose them to anything. So we're paying attention to that as well. So that's kind of the general overview. There may be some time that comes that we may have to make some buildings sterile. And what that means is it's a public building today, but it may not be a public building in the future, meaning that depending on the level of community spread, we would make those types of decisions as to limiting access. And when Jarrett comes up from Broward Health, he's going to talk a little bit about that as well with the hospitals are doing. And we'll talk about our vulnerable population a little bit later on because we have to protect certain elements of operations in the population because they're more susceptible to getting exposed. The next part of the operation I want to talk about is parks. I'm going to ask Rob to come up and just join us for this section of the conversation. Obviously, we have a lot of contact with the public through our parks department. We've asked Rob to take a look at all of our programming and start reaching out to the organizers. All of the events for this weekend have been canceled, and we'll talk more about events in a little bit. And we can also talk about organized sports leagues. Alex, I know we've been getting questions on that, and Rob has a little bit of an update for that. So, Alex?
Great, thank you. Good morning.
Morning. We've reached out to our youth sports organizations yesterday and discussed with them. We're going to keep operations as normal if they would like. A lot of them are already taking the precautions of taking a 2 weeks delay just till they see what would happen. But we told them until we give them further notice, we'll continue to let them play and participate as normal. And but be ready that if anything happens, that we will let you know, and we might have to just stop play at any time. So they have been notified of that. We've contacted all of our events that are coming up in the immediate future this weekend, and they've reached out to us actually, which is good, and we've already started getting some of them being precautionary and cancel or rescheduling their events. So that's good already to hear that everybody's on board with this. As of now, the facilities will still be open right now until we get further notice of any more of an outbreak coming our way. So our programs and everything are scheduled as continued as of right now. Except for our senior center, we are actually going to suspend all activities at the senior center for now until we get an okay or whatever to lift it and reopen them up right now. And also our special needs programs. So our special needs, special POPS programs also are all vulnerable to this virus also. So we actually are going to suspend those too. The other things that we got to be cautious of that we're still discussing is outside events that are coming in. They're not really events, they're scheduled our facilities. And as of now, if they come from a noted place that is carrying the virus, we will tell them no. And as of now, when it comes to Caribbean cruise liners and that use our aquatics facilities, we're going to have to go day by day with that also.
And we're meeting after this to get a little bit more into events and what we're going to do there. We do have language on restrictions of events according to size. So we'll talk a little bit more about that when we get to the events section of our outline. Alex, anything else you want to add to that?
We'll just add that our primary concern continues to be our elderly population, and you see that in the parks decisions. That's why we scaled back our senior programming first for Parks and Recreation, Information we're getting from our medical director for youth is that the youth are actually pretty resilient to this. So we're keeping that open play component open, and we're really monitoring, we'll get into the events, but we're really monitoring those types of events that are going to bring people in from outside the area, people that are coming from affected areas, and especially anything that would bring people from cruises or from CDC level 3 advisory countries. And that's where we see that active spread. What you could expect decisions to be made on in the future, especially related to parks, is that term community spread. So, declaring the state of emergency today, putting these measures in place, this is just what we would do with any other types of situation. We're getting our staff ramped up to respond. In the event that we see community spread or we see evidence that community spread is likely to occur, that's when we'll start to take actions to curtail, those types of leagues, those types of facilities, and as City Manager Babnick mentioned, making a public facility maybe a sterile facility in the future.
Understood. Thank you both. Thank you, Rob.
So to kind of a little bit more general on employees, some other restrictions that we're putting in place or precautions, I should say. Our IT department has tested and confirmed our ability to work remotely if necessary. We have the ability to keep the continuity of government and operations up and running should we need to start shedding employees for health concern to allow them to work remotely. So we have a plan in place that will allow for that, and it has been tested, and we're ready to go with that. We've canceled all business-related travel. So anybody who had any conferences or any business-related travel, that has been suspended at this point. No employees will be approved to move on with any kind of conferences or anything of that sort. Also, we still have to hire people and onboard people and do those types of things. So HR is working through a procedure to do that, keeping the recommended distancing and sterile environment needed to keep our employees safe. So that's kind of an overview of what we're doing from a continuity of operations and employee standpoint. So I'll pause there for any questions related to that, and then next we'll go into events.
Joshua?
At least for the youth programs, I know the youth, and I'm by no means I'm a medical director. It'd be nice if I was. The youth are fine, right? They're resilient. We've heard those reports, but it's parents, right, that will be there, and I guess the commingling of all the different parents and stuff coming for all the different matches and whatever other activities there are. If we keep this going, I'm just curious, if out of just an abundance of caution, if that's something we should be thinking about as well. Yes, the kids are fine, but it's the parents or the grandparents that may come. So,
Absolutely, and the primary concern when it comes to youth is that they are a vector for this disease. They get it, they bring it back to their grandparents, they go visit somebody, and then that's where we start to see the impact. That's why we're taking each sporting event on a case-by-case basis. So as City Manager Babnick mentioned, immediately following this meeting, we're going to discuss all of our park events and make those determinations on league sports and things like that. When we're looking at this, and we'll get into events, we're looking at crowd size. We're looking at how many people are congregating. So, father and son out on the baseball diamond, not as much of a risk as a tournament. And so that's why we're taking it case by case, because we want to make sure that any decisions we make are measured and they're based on what we think is going to have the most good.
and also just to make sure that if in the case that we have to postpone any of those major events or anything like that, that coaches don't on the side try to schedule practices or things like that, because I mean that happens a lot. So just kind of trying to make sure that it's look, everybody, let's do our part. Let's be serious.
And we've had a couple of the organized sports leagues already tell us we're good. We're gonna cancel programming for the next several weeks to kind of see how this is going to unfold, and then we're going to work closely with them. We're hoping to work cooperatively, but if the time does come and we have to make the decision will be made in the best interest of the community.
Thank you.
Sounds good. Commissioner Vignella, any questions? I'm okay, thank you. Commissioner Serra, any questions? Vice Mayor? Okay.
So, Mayor, when it comes to events, obviously, we just declared a state of emergency, and with this action, we're going to be imposing restrictions on social gatherings. The order applies to gatherings of certain sizes. We're going off about 200 right now. Anything that's over 200, we're suspending those types of events. And this will stay into effect until further notice. The order does not apply to schools, as the Broward School Board will impose their own restrictions. And events, for our definition, does not include regular attendance of schools, private or public, does not talk to places of worship, business, or transit. We're talking events that we have oversight over. So these events might be, community events, sporting events, parades, concerts, festivals, assemblies, conventions, fundraisers, those types of things. So those are the types of events we're talking about. And as Alex said, we're going to be looking at these, on a case-by-case basis. But there is very little likelihood that any events will be taking place in the foreseeable future. Alex?
Yeah, just really the three criteria we're looking at is the size of the event, the location of the event, and the type of the event. And then coupling that with the 200-person criteria that City Manager Babnick mentioned. So we're going to use those three criteria when we make our determinations to, once again, we're trying to assess risk. We're trying to see what risk it poses to the community and going from there.
Are there particular recommendations from the CDC for communities?
So we read the CDC special events guidance. We were wishing it was a little bit more defined. They do provide general guidance of what to do for, sanitizing, keeping, events. Their big recommendations are not to get a bunch of people, together in a small, compact area. So that's why in our criteria we had size of event and location of event, because a small venue with 100 people is a much, more significant risk than a much larger venue with maybe 100 people. So that's why we're using those three criteria.
So, Mayor, there is no criteria out there. We've done a lot of research. We've seen communities limit events from size of 50 all the way up to 500. So there's a pretty large spread in when it comes to the size of events. We've also seen some communities actually say that any public gathering is prohibited, even if it is in a business space larger than that number that they've set forth. So we went with this criteria because we felt it was very objective and something that staff could evaluate on a case-by-case basis.
I appreciate it. It's good thinking.
And then talking about some specific events, Our Town was canceled for this weekend. We had a swim meet out at the Aquatic Center that was canceled. The MLK golf tournament, Skip Campbell golf tournament was canceled by the committee. The farmers market was canceled. The street naming for Mayor Campbell will be postponed that was supposed to take place on Tuesday. And we're going to meet today. We wanted to get anything that was within that 72 to 96 hour window kind of taken care of, and then we're going to meet today, and we expect a host of further cancellations moving forward based on the calendar, which I don't have the full calendar in front of me right now.
Gotcha. Do we want to hear from Jared at this point?
Sure, we can bring Jared up, and he can give us an update on what's going on over at the hospital, Jared and his staff. Don't be shy, Allison.
Nice to see you, Jared.
Good morning, everyone. Good morning, Mayor, City Commission, City Manager, and team. Thank you very much for those that I haven't met. My name is Jared Smith. I'm the CEO of Broward Health Coral Springs, and I'm accompanied with Dr. Lai, our medical director over our emergency room services, and Allison Vendera, our director over the emergency room as well. Similar to the city, we have a very much coordinated effort. First and foremost, it is very coordinated with the city and your team here, along with the Department of Health, the CDC, the Florida Hospital Association, the county EOC, and our community partners. We are taking very similar actions as to what the city managers here today have discussed. In addition, from a healthcare perspective at the hospital, we have really increased our education not only to all of our employees, all of our physicians, our volunteers, and the community. we've implemented strict visitation guidelines so that if an individual is seeking to visit a patient in our hospital, we're following a very specific protocol as to what that looks like from a visitation perspective. From an emergency room perspective, and I'll ask Dr. Lai to share more detail on this one, we're working with our community partners. We're asking any potential patient who suspects that they may have flu-like symptoms or COVID-19 to call ahead so that we can reach out to them when they come to the emergency room, meet them outside, and give them the proper precautions so that we're prepared before individuals come into our facilities. We've done a tremendous amount of efforts as far as detailing our screening protocols. We've expanded our isolation and negative pressure rooms so that any potential patient throughout the community, and all hospitals are doing this, would be in an appropriate room, what's called a negative pressure room, so that the airflow is very different. That type of airflow exhausts directly to the outside, and that's a standard that every hospital has implemented as well. Let me turn it over to Dr. Lai to talk briefly about the protocols in the emergency room and what we're seeing. Thank you.
Thank you, Jared. Good morning, Mayor. Good morning, everyone. So definitely, COVID-19 is here, as we know. We do not fear it, but we do respect it for sure, And our goal is to flatten the curve and spread. That's what we can do best as a hospital, as a community. So I'm very confident in the protocols we have in place. We follow the CDC protocols, the Department of Health recommendations, and we work very closely with that, The hospital provides us with full PPE. Our staff as emergency medicine personnel, we've always been trained about taking care of the sickest, looking out for the worst. So we always take precautions, but we just take this at a higher level. So we continue to educate our staff, continue to update them on a daily basis as we get new news fed in to us. We work very strongly with our EMS partners and other partners as well. And like Jared said, they have been giving us pre-alerts, which has been very helpful to us so that our staff can prepare and get ready, because our goal is to mitigate risk and exposure to other patients as well as staff. So, the protocols we have in place, we have a set-up station so that patients entering the emergency department, before they even enter the waiting room lobby, they are screened there. We're able to put masks on them and to just limit exposure. And from there, we can kind of screen which patients need to be seen in the main ED or which patients can be screened. And we have collaborative efforts with our hospital epidemiologist, who works closely with the Department of Health and communicates on a regular. So from there, if we have a person, potential patient for COVID-19, we follow our protocols. We discuss it with epidemiologists, who discusses the case with the Department of Health, and then we follow the recommendations of testing and disposition, and we make sure we follow up with our patients closely. So, we encourage the public to continue to utilize the hotlines out there that are available that helps kind of pre-screen you, depending on the symptoms that you have or potential, exposure risks. So utilizing that helps us, get that pre-alert. We can meet the patients outside as well, put the mask on ahead of time and just limit exposure and follow our protocols. So I'm very confident in our process. And like I said, we don't fear it, but we respect it. And we all have to respect it going forward. And
Dr. Lai, if I may, can you just talk a little bit about, so the hospital does not get overwhelmed, at what point, I know a lot of the public, we get asked the question, at what point should somebody use the emergency department? At what point is it appropriate for them to come to your facility?
Right, so now they've started to try to have commercial laboratories do testing for COVID-19, and they are allowing patients, primary care doctors, to order these tests. I believe it's supposed to be available starting next week. The supplies of test kits have been limited. So I would recommend patients that are truly feeling sick as far as shortness of breath, chest pain, high fevers, you probably should come into the emergency room and get screened. But if you're just, you're concerned, you were part of, a situation where you're in an area, there was an outbreak, you're not really having symptoms, but you are concerned, you want to get tested, I think going through that screening process would definitely help, prevent overwhelming of the emergency department. But we do have a plan in place in case we start getting more surges. We will have stations set up in order to rapidly screen these patients and determine who needs to come into the emergency department and who does not, who can be tested and, discharged from the outside pretty much.
And Jared, could you just cover the visitation policy right now and where you see that going for the public?
Sure. It's changing quite frequently as we learn more and as the CDC and Global Health Organization have shared more information. The policy today is we have limited our visitors for to have one visitor per day, the same visitor, and that's just one visitor throughout the hospital, with the exception of maternity and pediatrics, which would be the mother or father to be able to be there, and that would be two parents or a caregiver. Those hours are from 8 to 11 in the morning, and then, 8 to 11:30 in the morning, and then 5 to 8 in the evening. As we work closely with the experts, I would anticipate that at some time that there's potential that gets restricted even further. We have seen in New Jersey, for example, in an area where there has been a higher concentration of COVID-19 patients, a hospital went on a complete lockdown and restricted all visitors. Our goal is to always be compassionate to our visitors and our patients, but at the end of the day, we need to take all precautions to protect our patients, and by limiting visitor flow, we're only enhancing that safety for the patients and our caregivers.
Yes, Vice Mayor.
I have a question for the doctor. Is there value in taking your own temperature at home?
I think so, definitely. I mean, whenever we have patients who are inquiring about fever, a lot of times it could be subjective in nature. Maybe they didn't have a thermometer to test it, but giving us an objective number does, I think, definitely helps, kind of guide us.
And that number is?
Technically, fever is 100.4 degrees Fahrenheit or higher, but, we had to take that on a case-by-case basis in, in conjunction with other symptoms that they may have or comorbid conditions.
So both for you, Doctor, and maybe Alex, when we say flu-like symptoms, multiple, how many? Could be one? So that's something that hasn't been clear to me from my...
Correct. Well, the CDC, they've kind of published some cohort studies of, they've been seeing how all these patients that have been tested positive, what's the most predominant symptoms they've actually shown. So initially, the initial studies showed that fever was a big part of it, but we've learned now that, maybe less than half will actually have presenting fevers. Some people just have, some sore throat, but dry cough seems to be most predominant, so we really just have to kind of do our diligence screening properly and going from that point.
Yes.
If someone is presumed to have COVID-19, what are your protocols, I guess, as medically and as far as notification-wise?
Well, if they are presumed to be COVID-19 or they're coming in for testing for such, we follow full PPE protection for our staff. Patient is usually met ahead of time outside of the emergency department, ensured they have a mask before coming in. We take them into a negative pressure room. If there are no negative pressure rooms available, we are able to take them into a private room, doors closed shut. We limit the amount of staff that is going to be caring for this patient to kind of mitigate the risk to our entire, department. And from there, we perform our exams, history, and then we consult our hospital epidemiologist who will consult the Department of Health. If we feel strongly this patient should be tested, usually that's what happens. So we get the instructions to test, and then what has been happening is the samples get taken to the Miami Department of Health lab to be tested.
And I guess I'm asking maybe for the general city staff as far as, let's say if we were to have someone, come to Broward Health in Coral Springs and they were presumed to have COVID-19, at what point would, I guess, staff be notified or someone?
So you're talking to somebody that's an employee of ours?
Well, I guess in general,
public?
just in general, public.
So,
If I could.
Yeah.
So right now, our dispatch center is hand carrying a flash drive that has information of patients that have been presumed to have the virus. Because of privacy concerns, we're not putting that out over the radio, even when our officers are dispatched. That's why we put protocols in place to protect our officers so that they get the information. Obviously, that's important, but that information's not being broadcast over the radio. So privacy concerns for, the patients that do have it are, something that everybody is taking very seriously. And so for that reason, there will be no public display or announcement of, okay, this address, this house, be careful.
Yeah, no, none of that.
Nothing like that.
No, I mean more as far as like, I don't want there to be some delay or some window into us, at least leadership or staff, knowing that it has somehow made its way, or, to Coral Springs. You understand?
Commissioner, we're working very closely with Department of Health. We're in contact with them every day. That information wouldn't come directly from the hospital. That would come through the Department of Health. They're the gatekeepers of that information right now, and we're talking with them on a daily basis.
Okay.
Very good. Doctor, lady doctor, I didn't get your name, I'm sorry.
I'm Allison. I'm the ER manager.
Wonderful.
She's the one who really runs everything, so.
Well, we appreciate you. Anything that you want to add?
I just want to give a shout out to the Coral Springs Fire Department. We've been in close collaboration with them, and the care has been seamless to our community. Thank you.
Great, thank you. So Commissioner Sarah, I believe you're still on the line. Is there any questions that you had, Commissioner?
Not at this time, Mayor.
All right, very good. Any other questions on the dais at this time? Yes, Commissioner Vignola.
If somebody were to come in and needed to get tested, are you guys having a hard time getting the tests available to them at this point, or?
Well, what's actually happening now is, as Dr. Lai had mentioned, it's being opened up by outside commercial labs. So now Quest, LabCorp have that capability of doing that. We believe that really beginning Monday or so, you will see an increased availability of tests. Today, the testing has been limited to very specific guidelines that are provided by the Center for Disease Control of a potential patient that could be suspicious of COVID-19. So we follow those guidelines. Anybody that meets those guidelines, we do have the capability of testing. And again, those tests are sent to a lab in Miami. And if presumed positive, it would then be sent to the Center for Disease Control to be retested in Atlanta before that patient is actually confirmed. So to answer your question, I really do believe that beginning next week, the availability of the tests, not only at hospitals, at physician offices, urgent care centers, is really going to make a major change and help, as Dr. Lai mentioned, smooth out this curve.
So, Dr. Lai?
Yes. Commissioner Simmons, just to kind of finish the answer to your question previously, also these test results have been taken between 24 to 48 hours from the Department of Health. Sometimes it may take longer. These patients, if they are not sick enough to be admitted into the hospital, they are instructed to go home and self-quarantine until notified by the Department of Health.
Commissioner Vignola.
So currently, someone comes in, you decide to order a test. How long till we get the response back, and we know for sure? And then will that change next week? What is that timeline going to look like next week with the opening of the other facilities?
Yeah, I would expect it to, in time, the timeline will get shorter. I guess there's two factors to that. First, to answer your initial question, I've seen test results come back as early as 48 hours, so it is getting better through the CDC. I would expect that as the commercial labs open up, there's probably going to be an abundance of testing that'll probably jam up the lab, so there could be a potential 3-4 day turnaround time. But then as, I guess, the calmness kind of smooths out a little bit, we would see more rapid turnaround on all results.
Yes, Commissioner Simmons.
Thank you, Mr. Mayor. And I guess, could you maybe explain, I know there's a lot of things out there about it's, the COVID-19 has a difficult time surviving in heat or anything like that. Could you speak more towards that, please? Like, is that true, or is that like a myth as far as, the warm weather being something that helps prevent the spread of COVID-19?
Yeah, that would actually be a better question for our medical director over epidemiology and infection control services. I think we'd have to defer to the CDC. At this point in time, we all need to understand that there isn't enough data that's out there to truly understand the disease and what shape it could take. So, I think we want to just focus on the facts. I think from our perspective as well, the number one precaution that we can all take is washing our hands, right? 20 seconds, soap and water. We can't underemphasize the importance of that because that's the first stop, right? Not to touch your face. There's studies out there that show that we each touch our face 100 plus times an hour. So it's quite significant. If you sneeze or you cough, make sure that you cough in your sleeve or whatever it may be, in your jacket, use a tissue. Again, wash your hands. We constantly need to be doing that. I don't have the actual number, but 85% of patients many patients are asymptomatic or not showing any symptoms. Many individuals around the world are having more heavy cold, flu-like symptoms, serious cough, respiratory, and are doing just fine. So I think if we all just remain steadfast with our commitment, make sure that you take the proper hand hygiene. If you know if somebody's sick, or you are sick, you should self-quarantine yourself because that really will make a huge difference with all of this.
So you would recommend that people stop bumping elbows?
Yeah, personally, I like the foot kick, if that's...
All right, so, yeah, go ahead.
So, one last question. Do we have and I don't know if you could share it or not, an estimate as to how many tests we're waiting on at the hospital here?
No, there's very limited numbers that are still outstanding at this point in time.
Good to hear.
And then when the test kits do come back, do you know across the board with Broward Health how long it takes for the public to be notified of the amount of cases in the county?
Right. Well, I believe, it's reported every single day. It's obviously evolving with what that number is. I don't want to misquote the number as to what's being reported out today. The Department of Health, though, is in close contact with any individual that would be impacted, and that's ultimately their responsibility to make that initial contact.
Great, so Alex, thank you very much. Alex, I have a question that may be for you. I'm not sure if Dr. Lee would answer it. I read somewhere yesterday about the rate of infection in China being much less, or being severely diminished from before. Are you familiar with that at all, whether that's accurate?
I can't speak to that, Mr.
Okay.
Mayor. I'm sorry.
Okay. Sounds good. And you can't either, I gather, Dr. Lee.
No, I can't really speak to that, although I did see the image where they showed the physician laying on the empty bed and all these other beds were empty. They said that was the makeshift hospital that they created in Wuhan, and they finished taking care of their last patient. So I saw that picture up there. They closed down.
Gotcha. Sure. So I want to repeat at least one or two things that Dr. Lee said, and that's how I feel, which is we do not fear, COVID-19, but we respect it. And I think that's a very healthy approach to the virus, because I think if we engage in that fear, engage in that panic, and project facts that aren't, quite here, won't help anybody. And Jared, you kind of said something about, stay with the facts. And, we're going to be learning, so as we're learning, we're going to be responsive and we're going to be agile, but this community won't be reactive. We're not going to be in panic mode. That's not us. Frank?
So Mayor, Jared, Dr. Lai, Allison, thank you guys for your time. I know you guys are busy. Appreciate it. Our next, I'm sorry.
I have one more question. I'm sorry.
Go ahead, Commissioner.
Thank you. As far as someone that becomes infected with COVID-19, let's say they go through treatment, they've been cleared, can they be reinfected with COVID-19? Is that something that you could speak to?
I actually don't feel like we know enough about it yet at this time to really say so. We're still kind of waiting to hear back and see these results of these patients being treated currently.
So what would your recommendation be for someone who, if they did have COVID-19 and they were cleared of symptoms, what should they do after that? Should they just go back out, or should they kind of remain quarantined? Is there any kind of guidance we can give on that?
I think that's up to, right now, currently, with the health department, once they if they lift quarantine or not, But I would just say, we have to just keep continuing, being vigilant about, preventative medicine and just taking all the precautions that we're doing from getting the initial infection.
Thank you.
So, Frank, thank you very much. We really appreciate it. Can we hear about the charter school at this time?
We have a couple more items on the
Sure,
list.
sure,
If
go
we can
right
go
ahead.
through, that'll kind of affect that. And then,
agenda works.
so the next thing I want to talk about was meetings, boards, committees, and groups. We are canceling all non-essential groups, committees, board meetings. If there's no imminent decisions that have to be made, we're going to be canceling those meetings, and those folks will be notified of that. Messaging, Lynn will work closely with Alex on messaging, both internal and external, to make sure that we're keeping our employees and our public as informed as possible, and she can kind of just quickly go over what that messaging will look like.
Good morning, Lynn.
Good morning. Yes, so starting today, since your declaration, we will be issuing our first press release under COVID-19 city updates. We will be regularly communicating with the public through our public-facing platforms on social media, the website, City TV, like we are right now, City Radio, and other forms of communication. The Public Information Office section of emergency management is effectively operating now. So we have 33 public-facing social media platforms. We have taken control of all of the social media communications so that we are effectively communicating the same consistent message, updating the public as necessary. When it relates to events that need to be canceled, currently we have suspended marketing future events so that we can focus on communicating with our business partners, our community partners, and the public about what we are canceling.
Sounds good.
Alex, anything to add to that?
I'll just add, so just like any other emergency, like a hurricane or something else, we're going to be publishing weekly incident action plans and also daily situation reports, which will provide updates with the latest intelligence and actions the city is performing. So that's going to be shared with City Manager Babnick, and he can share that information directly with you all so that you're up to date every single day as to what we're doing in the city.
The other thing that we would ask is that the commission share the city's message.
Sure.
And make sure that we're all staying consistent and united in our message to our public so that we're getting out the most accurate and up-to-date information as possible.
And I just wanted to add that on Monday, we will host another live Q&A with our medical director. That was very well received by the public, and I appreciate all of you sharing that information. That is something we're going to start doing moving forward. Its consistency will be determined on the spread of the virus.
And maybe we can get Dr. Lai to join us on one of those boards.
That's a good idea.
Yeah, we just invited you to a live Q&A.
I like putting him on the spot, so he's good.
Now, that was very, very helpful. A lot of people really appreciated that very much. Commissioner Simmons?
Will we, I guess, create, I know you say we're sharing updates under COVID-19, but will we create like a page or landing page or something where we have links and maybe even post those videos?
Absolutely.
Okay.
So yes, we do already have our page live.
Okay.
After this meeting, we'll be putting out a press release. We will be sharing that link. That link is going to be very important because we need a landing page. We need to direct people somewhere. That especially rings true when we're using our Everbridge system and other systems. So yes, and what we're going to ask our public, some days we'll be putting out multiple messages related to this topic. Some days it might be a little lighter. It depends on what's changing and what we need to communicate. What's most important is that we're not over-communicating as well. We don't want to alarm the community. We want to make sure that they're just well-informed and educated about what the city is doing.
Absolutely. So Dr. Lee mentioned a hotline. What is the number?
I will have the hotline number in the press release following this. I just don't have it on me right now, so I apologize about that. We have not opened our call center, which is under our public information section, but we will be promoting that hotline number that we have been for the last few days.
And really, you're doing an excellent job. Our whole team is doing an excellent job. You're ahead of the curve. We have the best first responders in the country. In my opinion, I think my commissioners would agree. You're the best of the best. So we really appreciate all your vigilance.
Thank you.
You're welcome.
Mayor, the next subject I'm just going to mention is something we're keeping a close eye on is the economic impact that this is going to have to, our community and around. Christie's keeping an eye out for anything that is published, and we'll make sure we share that. We don't really have any updates or any information on that right now, but it is something that we're following and making sure we're keeping an eye on the best we can. So probably the next thing we need to talk about is our vulnerable population. We have a vulnerable population registry that we use. We've been in contact with all of our ALFs and senior living facilities. City Attorney Hearn will bring you up to speed on something we want to take action on that'll give us a little bit more leverage to make sure that these folks are being taken care of at appropriate levels.
Okay, thank you, Frank. So we're going to be working on an emergency order concerning ALF. So there's restrictions for ALFs who can denying access to basically anybody right now. So we're going to have emergency order confirming that, requiring them to report to us, and we will put on our website who's compliant and who's not in order to be able to track that for emergency personnel as well. So there may be several emergency orders that we'll be working on. That is one of them. We were also looking into if it gets to the point of how we'll conduct meetings in the future that are commission meetings. I've been in contact with the Attorney General concerning that, and there may be some options depending on what level we need to get to. So,
Alex, anything further on vulnerable population?
I just want to say that we've already started outreach to all of these communities. Our fire department, our community risk reduction division, and our community paramedic have already visited these locations, provided them with information. Our HR department's done a full call down to let people know what they need to do to prepare. This emergency order is something that echoes what the State Division of Emergency Management has put out. So I think it's prudent for us to adopt that. It provides our ALFs and nursing homes with clear direction as to what they need to do. Attorney Hearn talked about the enforcement action there on the end, requirements. I did get the numbers for the two call-ins that you just asked for, Mr. Mayor. I could provide that, or Commissioner Simmons too. So for symptoms, if you're experiencing symptoms of COVID-19, your call-in number is 954-412-7300. Once again, 954-412-7300. And if you have general questions about COVID-19, folks can call into the Department of Health at 866-779-6121.
Great. Thank you very much, Alex. Can you share a little bit more about the resiliency of the youth? Are there just no numbers of young people contracting it?
So everything I tell you, I'm basing off of information I've gotten from Dr. Antevi, our medical director. So it's not that youth are not getting cases. It's not that youth are, immune to this. His direction was that youth are getting, if they do catch this disease, it's staying, upper respiratory. They're not developing that cough. They're not developing the more severe cases. The primary concern that Dr. Antevi expressed to us concerning the youth is that they then become a vector for that. So we have spring break coming up. We have, people coming home. If they are a carrier of this virus, they go visit their grandparents, they go visit their elderly relatives. They can be that vector that then leads to those folks having a more severe case. So, and as the doctors from Broward Health mentioned, there's still not a whole lot of data on this. I think that's what where a lot of the uneasiness comes from in the media. As we get more data, we'll start to get better information out of the CDC, better information out of our healthcare providers, because right now we just don't know what we don't know. So the best message we can provide to people is to be cautious, be careful, and we'll see how it shakes out.
Thank you. Yes, Commissioner.
For the ALFs and especially the senior facilities, what type of, guidance or precautions are we asking them to take? Because obviously we can't, order them to do things, but, Are they talking about doing increased wellness checks? Are they, thinking of different ways to contact, stay in contact with people? We don't want someone getting sick in their living space and no one's hearing from them, what are they trying to look at stopping visiting, visitors and different things like that? Is there any of that talk going on with them?
So there's a couple of different avenues that we have. So first and foremost, a lot of these entities have taken steps on their own, proactive steps on their own. So we've been hearing about different ALFs and nursing homes that have restricted visitation from outside visitors. So that's one side of the equation. The emergency order that we were presenting to you today, has a list of screening questions. So before anyone is allowed entrance into that facility, they are asked a series of screening questions. Are you experiencing signs and symptoms? Have you been on a cruise in the last 14 days? Have you been to an area where there's a CDC travel advisory? The basic questions that are recommended by the state to screen for people who might be at risk as a carrier of this disease. So that's that one aspect. And then the third aspect of this is just that general preparedness message. At this time, if you're sick, we do not recommend that you go to a nursing home. We highly discourage that. And that is also going to be in conjunction with our care. And I could let Chief McNally chime in if he has any additional, but I know that based on whether it's an assisted living facility or a retirement community, our paramedics are going to handle those cases differently. If it's an assisted living facility, we're trying to remove that patient so that we're not encouraging the spread, whereas if we're in a senior retirement community, we may promote them to just stay in their unit or their room, self-isolate until their symptoms have passed.
That's correct. So the emergency order is going to pertain to our group homes, our facilities, the adult living facilities. They don't cover some of our other facilities that have an elderly population, which are more vulnerable. But we're treating them the same, meaning that we are providing that education. We've been in contact with all of them, and we're going to be pushing out a new wave on Monday with an intention of every week having a call down with them. We're going to be conducting a webinar with them, with Dr. Intevi. I spoke with him this morning. So we can educate them on things that they can do that's even enhanced from the order that came out from the Florida Department of Emergency Management. So we are taking these steps. We're keeping a watchful eye. We're going to do this weekly, being that that's our highest risk, and provide those measures to them.
Great, thank you. Any other questions from the dais at this time? Great. Okay, Commissioner Simmons.
All right, so when it comes to, I know we only control one water district, and I hope that we are going to have conversations with the other water districts, but we need to make sure that in this time of emergency that we aren't completing any kind of utility shutoffs or code violations or things like that. Like what's the protocol with stopping the utility shutoffs and things of that nature?
Commissioner,
for us.
Yeah, Commissioner, that'll be topic of this conversation right after this meeting. We'll come up with what that protocol will be moving forward. Possibility. There's no telling as to when that will happen, but we do have plans for it. But I do think that is a likely possibility at some point.
And I guess, and I don't know if you know the number, but how many employees are, hourly? If you know, does anyone?
How many are out ill?
Hourly, yeah.
Hourly. I'm sorry.
Paid hourly.
I would say probably 80% of the workforce, Dale.
And I get that could be a challenge with the next question I'm going to ask, but in case people are sick and exhibiting symptoms and they want to self-quarantine, or I don't know, abundance of caution. I know you mentioned sick leave, but are we talking about paid sick leave as well?
So that's another part of the discussion for today. One of the things we're looking at is basically if somebody's willing to come to work and we tell them they need to quarantine because they're showing signs and symptoms, for example, we're causing them to stay home. They're not causing themselves to stay home, so we would cover them at that point. But if somebody took personal travel, for instance, and so it's kind of we're defining that line, and that is one of our topics of conversation today.
I mean, and as well as maybe that employee has a relative who gets sick.
They need to care for or whatever,
Yeah.
So we're going to talk through all of that today. We'll have an update for you on that.
Okay, and I guess my last question, and and this might be for Chief Perry, for our known homeless individuals or anything like that, I guess that should be under vulnerable populations. Is there any type of outreach to them or, something? I mean, obviously they're transit population, so it might be hard to get in contact with them, but that's why I said known individuals or families.
Yeah, we have the homeless advocates in the police department that go out. We were just recently talking about one subject yesterday. We're going to reach out to all of them, encourage them to, obviously, seek shelter and try and help them wherever we can. The problem with some of the homeless is, there are resources out there, and, we do try to connect them with those resources and make sure and then follow up and see if through connecting them, we can lift them out of homelessness. The problem is a lot of times they just don't want the services that we offer, and we can't force them to take those services. But that is something we're going to do. We're going to try and go around and make sure that we address everyone that we're aware of and try and get them in a place where, safety and better clean conditions will work.
I actually have one more question, and I guess for both departments, public safety departments. As far as, I guess, what new protocols or guidelines are given to, officers and firefighters and EMTs as far as interacting with the population, I guess, in this time? So are they wearing gloves? Like, what are they doing a bit differently as they try to, continue to provide service?
So we're following the same recommendations that we're telling the public as far as keeping the distance. Any of these patients that we come out to that we feel are having any signs and symptoms of the flu, we're asking them to call ahead, do FaceTime if they can, video conferencing, asking for the patients to come outside, so that way we're not going into a enclosed area. So we're doing the same thing as far as keeping that social interaction spacing of, we've said that the CDC recommends 6 feet, we're asking for 10 feet. And then based upon those parameters, if they need to use a layer of personal protective equipment, they're doing it.
Yeah, same, as Chief McNally said, the reality is that in some instances, we just simply have to go and interact with people. We are emergency services. So, in those situations, they are wearing protective equipment. I don't think that we are to the point yet where we're donning Tyvek suits and all of that, but I want you to know that we are monitoring this, hourly, and we are taking our keys from Alex and the CDC, and we are taking it very seriously. I would say right now what we're doing is necessary. I'm glad that we're here today. I think just like we prepare for a hurricane, the hurricane's not here yet, but we need to have a plan in place, and we need to act, and we need to prepare, and that's the stage where we're at right now. So, we're making sure that all of our officers are aware of what's going on. We're trying to communicate that message as much as possible and make sure that we're prepared. And, the safety of our officers is important to the safety of the city. We need first responders to be able to do their job, so we're taking every precaution we can to ensure that that's occurring.
Thank you, Chief. Gary, if we can hear from you about the charter school?
Mayor, that's a separate meeting. Yep.
Oh, Frank was...
So, John, we have to wait to conclude this meeting to start that one then?
Okay. But we would conclude this meeting and we would start that one. So if there's anything else concerning the city, not sitting as a school board, this would be the time.
Okay.
No problem. So we'll begin concluding our meeting with final comments from the commission. As I'm seat 1, I'm going to go first as the mayor. So I just want to thank my fellow commissioners for being here today and for your support of our community. You've given a lot of great feedback and asked some great questions and made some great recommendations to the community as it relates to the coronavirus and our decision to declare a state of emergency. The one common thread from all of our commissioners and all of our leaders is the safety and well-being of our residents. That's the #1 responsibility of our government, and we take that very seriously. Coral Springs, thankfully, is a community that comes together when faced with adversity, and we've already witnessed that in the past. Today, tomorrow, and the next few weeks, we're going to continue to come together, and our message will be the same. We need to work together. We need to work based on facts, not on fear. We need to be responsible when buying supplies. We need to check on our neighbors. We need to be calm when all else may feel out of control. And I agree that cancellations, some postponements of events are in the best interest of the community that we are dedicated to serve. Many of you have said it, and I agree. I support the management team of Coral Springs to once again lead us through these tough times. To our residents, we're committed to providing information and updates on a timely basis regarding the coronavirus through our website and our 33 modes of social media communication. If you want to speak with me directly, if you have any questions, you can call me on my cell phone at 954-494-9872. So next we'll go to seat 2. Is that Sean? Is that Commissioner Sarah?
Yeah, so Sean had to, he had a meeting, he had to drop off the line.
Seat 3.
It's me. First, I want to thank Frank and Alex specifically for everything you guys are doing. Really appreciate it and keeping us up to date and doing everything we can to handle this in the most responsible manner as possible. It's no secret that there's some hysteria related to coronavirus. That's evident from our store shelves, from hygiene supplies to bottled water. People need to remain calm. I remind our residents that our water supply is safe. There's no need to go out and buy up all the bottles of water out there. Washing your hands is still the best way to protect yourself and others from the spread of germs. We have to rely on the expertise of our medical professionals and the recommendations they offer. I too support our city's management team and remind our residents to stay informed by following the city on social media and checking the city's website. If anyone would like to speak to me, please call me on my cell phone at 954-632-7544.
Thank you very much, Commissioner. Vice Mayor. Your seat 4? Wow. Or your seat 4? I don't know. Your turn then, Commissioner.
I agree with the comments from the members of the commission. Tuesday is the state of Florida primary election day. And while we are all practicing social distancing, we should all exercise our right to vote. I know City Hall is a voting location for multiple precincts, as well as other facilities which will remain open. All I ask is that you follow the safety protocols that the city and the Department of Health have been promoting. Wash your hands, use hand sanitizer, and cover your mouth and nose with a tissue or with the crook of your elbow when sneezing. Follow the city's social platforms for up-to-date information and cancellations. And if anyone needs to speak with me, please give me a call at 954-871-1314.
Thank you, Commissioner. Vice Mayor.
Well, first I want to say thank you to city leadership and to staff. This has been a tough decision for all of us in terms of canceling events. March is our biggest month for outdoor events and festivals because in South Florida we are fortunate to have such beautiful weather to congregate and enjoy. It's also no secret that I am personally invested in the Festival of the Arts, but for the health and well-being of our residents, especially our senior population, it is so much more important. I ask as residents that you look after one another, especially the seniors or disabled neighbors, to ensure that they have what they need and do not have to go out for food or supplies if they are immune compromised. I'm asking you to monitor our city website at coralsprings.org and our social media outlets for updates as they occur. This will be a hardship for all of us, so look for many of the wonderful events to be rescheduled in the future. If you need me, I can be reached at 954-998-4186 or Joy Carter at coralsprings.org. Thank you, and stay healthy.
Wonderful. Thank you very much. At this time, we're going to wrap up this meeting. We're going to take a few-minute break before the charter school board meets. We wish you a great day. We may be slowing down a little bit, but we're not going to be stopping in our city about getting us together and providing services for our community and being united. So thank you all for being here. Have a great day. We are adjourned.